May is Mental Health Awareness Month, and having access to the right care, it's critical, which can be hard if you have to sit in an emergency room just waiting to be seen. So the staff at Dignity Health's Mercy San Juan Medical Center tells me that their emergency department has been filled with people experiencing mental health crises, which put a strain on the hospital and really on patients. So in tonight's main point, we're getting a closer look at the changes that they have made to patient care that are working. Mercy San Juan Medical Center sees about 5,000 patients a month in their emergency room, and 400 of those patients are behavioral health related, a number that has steadily increased. Mercy San Juan Medical Center's president, Michael Corpiel, says before creating their crisis stabilization unit, the only place people could come to was the emergency room for mental health issues.
We didn't really do a good job of handling patients and managing patients who came in with a mental health crisis. And so it really put pressure on emergency rooms like Mercy San Juan that are level 2 trauma centers.
33 hours was our average. Patients waiting for an inpatient psychiatric bed. And they're lined up in the hallway, on gurneys, just waiting, not getting their needs met.
Dignity Health, who operates Mercy San Juan, says many of the issues come down to not having resources readily available.
I think a lot of it is not understanding it fully. We should be able to treat them just as a medical emergency when they come into the hospital.
The medical needs trump the behavioral health needs in terms of room, space, and equipment. The hospital recognized this is an issue. We have to find a way to address this.
Mercy San Juan Medical Center in Carmichael first opened their crisis stabilization unit in 2019 before the pandemic. Since then, Dignity Health's behavioral health program manager tells me that the need for services has only grown.
We transfer them over here. This is where all of our experts in mental health are. We have psychiatrists, social workers, mental health nurses, peer support specialists, all who can really work directly with the client to see what their needs are and develop a safe treatment plan for them.
And then so once patients go inside, then what happens?
So I can go ahead and show you, but our nursing staff takes over from here to get them set up and get them familiar with what they can expect while they're here.
To protect patients' privacy, we did not bring our cameras inside the CSU. But what we witnessed is patients are immediately being greeted by a staff member in the quiet space away from the emergency room.
All diagnoses, all types of issues that arise, whether it's somebody who's acutely suicidal, somebody who might be in a psychotic episode, either due to their pre-existing condition or under the influence of street drugs.
The CSU's medical director says most people they treat and assess are able to be stabilized and discharged within 24 hours of seeking care.
It was modeled on a model of care called EMPATH, which is the acronym for Emergency Psychiatric Assessment and Treatment and Healing.
The EMPATH model allows for patients to be cleared by the ER department and go straight to getting that specialized behavioral health care. And with the CSU, the average time for patients to get care has gone from 33 hours to 3.4.
Now the CSU is a calming, healing, comfortable environment. Way back in the day, it was giving someone a sheet of paper with numbers on it. Hey, follow up with this clinic or follow up with this. Nowadays, we're doing a lot more of warm handoffs where we're setting people up with appointments with a counselor or a psychiatrist before they leave.
The care is so comprehensive and it's so fast. We have a psychiatrist on site 10 hours a day who meets with our patients.
So you say better outcomes and it's less expensive as a whole. Can you talk a little bit more about that?
What we have seen prior to the CSU is that we would treat patients, and when they didn't really meet criteria for the inpatient setting, we would release them back into the community. And invariably, a high number of them would end up right back in our emergency room. The number of patients that have come back to the emergency room from their stay in the crisis stabilization unit has gone down tremendously.
And after speaking with these doctors and nurses, I wanted to share a few takeaways. They say, one, don't be judgmental and understand that this person is in a true crisis situation, so do not minimize it. Secondly, get treatment and just be supportive. With treatment, people can recover.